So today I'd like to talk about hernias, which is one of the most common reasons why an otherwise healthy child might come to meet a pediatric surgeon. So a hernia is really any spot in the body where there is a hole in a normal muscular layer that allows things that belong in one body cavity to enter into another. The most common hernias that we see in an otherwise healthy child are going to be hernias at the belly button or hernias in the groins. Both are reasonably common. Umbilical hernias are very common, and this can range from the outie belly button all the way up to a large umbilical hernia that actually causes discomfort and or cosmetic concerns. An umbilical hernia in a child who's under the age of about 4 or 5, in most cases, doesn't actually need surgery yet. About 80% of those hernias are going to close spontaneously or on their own. The things we look out for, and the things that I would encourage any parent to look out for whose child may have a little bump on the belly button, would be if that spot becomes hard or can't be pushed or squished in, if the area becomes red, or if the child is acting like it's tender or really hurts. All of those things can be markers of something that belongs in the belly having come out and gotten stuck in that little ring. When we fix hernias, it's an outpatient procedure. We make a little smiley face incision under the belly button and simply push the contents that belong in the belly back in and close the muscle up. Hernias in the groins, or inguinal hernias, are the other common type of hernia that we see in healthy children. These are more common in boys than girls. Unlike umbilical hernias, hernias in the groin don't close on their own. So any child that's found to have a hernia is going to need surgical closure. Typically, we would recommend surgical closure. Certainly, if you've noticed a bump or bulge in the groin, or you have noticed that your child's belly button is a little bit more of an outie perhaps than you would expect, these are good things to talk first to your pediatrician about, get an opinion as to whether or not there might be a problem. And then as surgeons, we're always happy to speak with families and kind of explain things and offer a recommendation on whether it might need to be fixed.